Hello everybody and welcome to the very first episode for 2014. Ask Dr. Bob. I'm so excited, a lot of tremendous questions. Dr. Bob, thank you for your answers in reference to Celtic sea salt and iodine. I have a question. How much Celtic sea salt is safe to use every day? Traditionally, I recommend around 1/4 of a teaspoon of Celtic sea salt in a quart of water. I would say you could comfortably use 1/4 of Celtic sea salt, 1/4 teaspoon of Celtic sea salt on a regular basis. I have not had anybody at all increase their blood pressure using Celtic sea salt. If anything, Celtic sea salt will help lower your blood pressure. It is a tremendous product to help every aspect of your health. Dr. Bob, you mentioned on one of your videos about using Iodine, and then you went into the details of the micrograms, etc., of the iodine in the product. I want you to know at the present time, I use a product personally called Iodine. I take 1 tablet of Iodine every day. Now, before you start taking iodine, it's always a wise choice to have your TSH, T3, and T4 to see how your iodine is working via looking at the T4 itself. The most scientific way to analyze what kind of iodine or how much iodine you need is a urine iodine loading test. And you could go to our website for more details. It's a very important test. Dr. Bob, a lot of thyroid questions. I just received a TSH of 17.47. Now, I can tell you from my experience, that is definitely on the high side. You probably have subpar thyroid function. In our practice, we would use a product called GTA, which is porcine thyroid tissue. We would also use iodine and L-tyrosine. I would at least suggest 1 12-ounce tablet of iodine every day, and the L-tyrosine I would take anywhere from 2 to 4 plus optimal EFAs. Dr. Bob, can you give me an advice about gum disease, infectious disease with shooting pain? Well, if it's an infection, I would definitely talk to your dentist, because the mouth has a big impact on what happens with your heart and other joints in your body. I want you to know I would avoid sugar. I also personally use a product called Agricept L. It's a citric seed extract. I take 10 drops every day and 4 to 6 ounces of water, and I've been using it since 1976. It does not have any bad effects. Citric seed extract, lemon, grapefruit, and tangerine seed. Dr. Bob, this is the first time I had this question asked me. What do you think about Amy's Foods? Well, first I want you to know that my wife and I use very little processed food from any company. When I say processed food, I'm talking about canned food or starters. But I did my own research on Amy's Foods, and what I'm perceiving at this point is that it appears to be healthy. But I want you to know that I don't eat soy products. I know that they have vegetarian type of products which use soy, so look at the ingredients, because I know a lot of these larger companies today are purchasing places like Amy's, etc., and they're changing the ingredients, so always check the ingredients on the labels. Last question, Dr. Bob, what's your prescription for high blood pressure? Well, in our practice we use magnesium. Magnesium has helped so many of our patients lower their blood pressure naturally. We actually have a liquid magnesium that we encourage our patients to take 2 teaspoons before bed at night. We use also a product called MGzyme. Once again, tremendous products questions. I'm looking forward to 2014. Go to druglessdoctor.com and join us with our #OptimalYou. It's going to be a fun year. See you next time.